Oke, baik teman-teman. Assalamualaikum warahmatullahi wabarakatuh. Selamat sore. Hari ini kita lanjut presentasi hari terakhir ya. Dan presentasi hari ini sangat menarik. Mudah-mudahan menariknya tidak kurang dari presentasi yang kemarin yang dibawakan oleh Maria dan Mark. And for audience, good afternoon, ladies and gentlemen. The honorable person, Mr. Syahmirza Indra Lesmana, and the honorable person, Ms. Luciana Demichelis Mendonca, and all of beloved participants. And for all, let us thanks to the Almighty, Tuhan Yang Maha Esa, because of His blessing, we are able to come here to join again in this online seminar meeting by Indonesian Sport Physiotherapy Community in collaboration with the International Federation of Sport Physical Therapy. And secondly, salawat and salam also delivered to our Prophet Muhammad Sallallahu Alaihi Wasallam, who has guided us from the darkness into the brightness. Okay, well teman-teman, ini this is the second time ya. We have another guest from the International Federation of Sport Physical Therapy members. Before this, we have met with Ms. Maria and Mr. Mark, and then, ladies and gentlemen, the presentation today that are for the first presentation from Mr. Syahmirza Indra Lesmana for opening. Ya Pak, gimana Pak?
Ya boleh.
Boleh ya? Atau langsung aja? Langsung aja Pak ya?
Boleh sedikit aja. Ya, kamu udah ngomong begitu.
Okay. And the second presentation from Ms. Luciana. Okay, well, ladies and gentlemen, now let's open our meeting by saying as Basmalah together. Bismillahirrahmanirrahim. Okay, thank you. The next, for the first turn, will be given by the first presenter. Please welcome Mr. Syahmirza Indra Lesmana.
Okay, good afternoon, ladies and gentlemen. Assalamualaikum warahmatullahi wabarakatuh. First of all, I would like to say thank you for joining with us, Ms. Luciana Demichelis. Thank you very much for joining with us. It's very honor for us to get the Secretary of International Federation of Sport Physiotherapy to give a presentation in this. So may I speak in Bahasa for my participant? Is okay, Lucia? Okay. Teman-teman sekalian, kita sangat berbahagia sekali karena pada sore hari ini kita kedatangan tamu yang sangat-sangat istimewa. Beliau adalah Luciana Demichelis, itu adalah Sekretaris International Federation of Sport Physiotherapy. Beliau lagi melakukan penelitian tentang injury prevention, ya, postdoktornya, dan dia akan memberikan materinya pada hari ini, ya. Jadi ini hanya kami ingin memberikan gambaran bahwa memang PFOI ini sangat berhubungan baik dengan IFSPT, dan saya minta kepada teman-teman untuk menyimak dengan baik karena inilah materi yang sangat luar biasa dan merupakan membuka wawasan kita dan memperlihatkan bahwa kita memang sudah layak untuk menjadi anggota IFSPT. Selamat mengikuti teman-teman. Sekali lagi ini adalah kegiatan hari terakhir kita. Mudah-mudahan bisa memberikan manfaat buat semua, dan mudah doakan kami di PFOI tetap bisa menjaga mutu, standar, sehingga kami tetap bisa bersaing di dunia internasional, dan juga kami akan selalu berusaha untuk menjadi organisasi yang memberi bukti, bukan janji. Terima kasih, selamat menikmati seminar pada hari ini. Wassalamualaikum warahmatullahi wabarakatuh.
Wassalamualaikum warahmatullahi wabarakatuh. Terima kasih Pak Indra. Baik teman-teman, saya sedikit memberikan informasi bibliografi tentang Luciana Demichelis. Okay, Luciana de Michaelis Mendoza is a sport physical therapist, PhD in rehabilitation science. Currently, she is the coordinator of the postgraduate program in rehabilitation and functional performance of the Universidade Federal dos Pelos do Jequitinhonha, Amicari. She works as adjunct professor at UFPJM, and she is a collaborator professor of the postgraduate program in physical therapy at Universidade Federal de São Carlos. She was the president of the SONAFES Executive Board, Brazilian National Society of Sport Physical Therapy, in 2016 till 2017, and also engaged on the organization of the physical therapy service of the Rio 2016 Olympics and Paralympics Games. And nowadays, she is in the executive board of the International Federation of Sport Physical Therapy. And teman-teman, Luciana ini punya sedang studi penelitian, dan her main research topics are pertama, functional performance assessment and intervention processes, and yang kedua, epidemiology and sport injury prevention, and yang ketiga, application of complex system analysis in sport science, yang dimana she helped to develop a sport physical therapy application and to improve the assessment process. Okay, next turn is for the second speaker. Please welcome Ms. Luciana. The screen is yours.
Thank you very much, Chakra. It's really a pleasure for me to be here with you all. I thank you. Thank you all for joining us in this seminar. Let me just share my screen and start my presentation. Can you all see?
Yes, it's clear.
Yes. Yes. Okay. So it's a pleasure for me to be here. Thank you very much, and good afternoon to everybody. I'm trying my best here to speak a good English and slowly so everybody understand it. And if you see any problems with my audio, please let me know, then I can fix it here and repeat anything that you wish, okay? So, let me see, I'm having a problem here. The slide is not. Okay, I'm having a problem.
You close first, and then you try again to you exit from the slideshow, and then you try again to slideshow. Sometimes it's happened like that.
Yes, but I blocked the Zoom. It's like blocked. Okay. Now the slides are showing, but I want to come back and I can't.
Okay, just out. Maybe you just stop share, and then you open again your.
Yeah, I'm trying to do that, but like my computer has like blocked. I think I need to.
That's it. Can you help to share your screen first for? Yes, that's right.
Yes, thank you. Yes, the problem's okay. Now I'm back. So I try again. Okay. Do you see my slide?
Yes, it's clear.
Now it's okay. So as Chakra said, I'm from Brazil, and I'm a professor in a federal university there. This is a picture of the campus that I work. It's a small city in a state that the name is Minas Gerais. It's near Rio de Janeiro and São Paulo. That's the most famous states that we have in Brazil. And in this small city, it's a really beautiful place with a lot of mountains and waterfalls. And it's really a pleasure for me to work there. I'm having a problem again. Okay, but I keep going. And I'm a member of the Brazilian National Society of Sports Physical Therapy. This picture shows up some females associates that we have there in Brazil. It's a good group, a strong group to work with. And I worked in the our association board for 6 years. And as Chakra said, I was president during 2016 and 17. So during Rio 2016 Games, I was president of our national society. It's really an honor for me. And now I'm at the IFSPT board. I'm since 2017 working with IFSPT board. I'm the secretary now. In this picture was taken in our last conference, the World Conference of Sports Physical Therapy that was held in Vancouver last year in Canada. It was a really amazing conference. In this picture, we have some members that were delegates at our general meeting that happens every 2 years during the World Conference. So I hope to see you all next year because our conference will be held in Denmark, in a small city. The name is Nyborg, and will be in August. So maybe we can meet there and see each other face to face. And now I'm living in Ghent, in Belgium this year because I'm doing a postdoc with Eric Wittbro. Eric Wittbro is an important researcher that published a lot of papers about injury prevention. So it's a big challenge for me to be here, away from my friends, my family, but trying to increase my knowledge about injury prevention. So I'm doing this postdoc at UGent, the Ghent University. And it's been amazing despite this whole situation about the lockdown, but now things are better here. And most important, I'm a mother. I have an amazing daughter. Her name is Thais. She's 11-year-old and she loves soccer. She loves. She wants to be like a soccer athlete. So a lot of things that I do that is related to my job is also because I want that my daughter can achieve her dreams. And I always show her picture in conferences, and she gets really happy when I say to her that I show her in my presentation. So that's my beautiful daughter. So starting to talk about injury prevention. So we all know that sport injury, it's a burden, not only for the athlete, the sports team, but also the family, the manager of the team, the audience. Because, for example, if we lose our most important athlete that plays in our team, would be really sad thing, not only for the athlete, because nobody wants to get injured, nobody likes to be injured, but because the athlete won't play and the audience maybe buy that ticket just to see that athlete playing and she or he is not there playing the game. And also about the sponsors, the manager, all that expectation. Maybe we can lose this most important athlete in a last season game, in a final match. And maybe we can lose even a championship because of it. So injury is a burden. And of course, we as physical therapists, we need to deal with this. And I know that for everybody that already worked in a sport team, the feeling that we get, that we have, is that we are almost running against the clock all the time, because the feeling is that we have amount of time, and we frequently we cannot do the whole tasks that we wish to do during this time. I don't know how things is in Indonesia, but in Brazil, for example, I can see a lack of physical therapists that are working in sports team. It's commonly there you see like 1 or 2 physios working in a sports team that have like 50 or 100 athletes. So this proportion, it's not ideal, let's say like this, because we face a lot of pressure when we look at the physios that work in a sport team. Maybe after the talk we can chat a little bit about how is in Indonesia, and also I can talk about a little bit about Brazil. But that's the feeling. We are always running against the clock. And we know that we have some important tasks to deliver. So this slide shows 4 areas, 4 things that the physio usually do when he or she works in a sports team. So of course, we need to do rehabilitation. This is the most famous thing that the population knows that physical therapists usually do. It's rehabilitation. Okay, but it's not all about that. If I work in a sport team, I need to do rehabilitation. I need to do return to play. Of course, that not always is only the physio that is working with return to play. Usually, he or she works together with the strength conditioning coach on this transition. But we also need to perform emergency care on a field of play. If an athlete gets injured during the training or during a match, we need to be there to give this athlete the first care. So we need to watch. We need to be present in all matches, all training. This is time consuming. And we also need to do prevention. So it's really common in Brazil when I talk with my friends that works in a sports team, and I myself already had this experience. It's common to see they saying that, okay, I don't have time to do prevention because I already do a lot of things and I can't organize myself to have a specific time to do injury prevention. Okay, I can understand that. I already worked in a female soccer team, and I already work in the Brazilian national male volleyball team with the young athletes. So I know that we are running against the clock, but we need to be aware that it's our obligation to deliver the best job, the best energy that we can to this group of athletes. So I know that it's challenging, but we need to identify some strategies that can help us to deliver also prevention. This graph shows some areas that we need to be aware when we are thinking about being a professional, a good professional in our field, and even being a reference, an expert in our field. So I know that the last slide talks more about the basic competence that the physios should have. But it's not only about these 4 areas. We need to be greater than that. We need to have like global competencies that lead us to be an expert. I know that this happens with time. When years pass by, we get like more knowledge, we talk to our colleagues, we learn from them, we learn from our mistakes, and this is a process. But when we think about what I should have to be a professional leader, a professional advisor, a reference. We need to be aware with all these issues that are identified in this figure. So in the center of this figure, it's about mostly about the what I said in the past slides. It's most about that 4 areas that we need to be aware in return to play. That's the basic, but we need to be global. And that's, I'm talking about the other items that are included in this graph. So I will talk a little bit about this just to get this more clear, and then we are going to advance in injury prevention. So when we look to IFSPT website, we can see there 11 competencies that our international federation thinks that it's important for all sports physical therapists to develop. And again, I know that this happens with time, but it's good to have this guidance since the beginning to allow us to be better professionals. So we need to deal with injury prevention. That's our topic here. But we need to deal with acute intervention, rehabilitation, performance enhancement, promotion of a safe, active lifestyle. Because sometimes we think about sports physical therapists only working with elite athletes. And that's not the idea. Yes, we work with elite athletes, but also with amateur athletes and also with people that aren't athletes. They don't take money from their practice. Maybe they even don't participate in competitions, but they do physical activity. And this is inside our competencies. It's a sport physical therapist is the professional that have a closer look to this profile of people that do physical activity. So we need to be aware of this. Continuing with the competencies, we need to have a lifelong learning. I talk about this always with my students. I say to them, I'm always learning. You may think that I know a lot, but my feeling is I never will get this feeling that I know 100% of everything. So we need to be humble and be aware that we are always learning through our life, through our process, in our profession, in our personal life, and wherever. We need to also be aware of professionalism and management. So don't think about management only if you have a manager position. Because you as a sports physical therapist that work with a sports team, for example, you need to manage your time. You need to organize, prioritize what you need to do with your athletes and what is your competency and what is not. Because if you identify something that is not under your competence, you need to get help from other professionals, the psychologist, the physician. So we need to work as a team. Also, it's important to have a research involvement. And I'm not talking about that you are obligated to be a research. It's not about that, but you need to engage in the science, in sports science. That's our area. So you can join accomplish these competencies, helping researchers to develop their studies. So, for example, Indonesia Sports Physical Therapy Group, you are helping me in my research, in my postdoc research, because some people are filling some online surveys, and this is the way that you can be involved in research. One example. Okay, if you want to be a researcher, go follow your dream, but it's important for us to get closer, the clinicians, to the science also. Clinical practice and research always work together. So we need also to disseminate the best practice, and maybe this item made us think about evidence-based approach practice, because we need to deliver the best effective intervention, for example, for our athletes. So maybe I can believe, or I can think that some intervention it's important for my client, for my athlete, but I need to be aware if this intervention have evidence. Because if the evidence says to me that this intervention doesn't give any benefit to my athlete, or even worse, maybe some evidence could decrease athletes' performance and get their injury worse, for example, I cannot implement this intervention to my athletes. This is unethical. So we need to be aware of this, of course. We need to extend practice through innovation. I'm not telling you that you need to give up of everything that you do in the past and be like in a company to develop a fancy thing, equipment or an application. No, it's not about that. But I'm giving you my example. So what happened to me? How I can extend my practice through innovation. I joined with friends, and we, for 15 years, we worked with pre-season assessment. We worked in a laboratory of the university, and we invited athletes to get the assessment in a pre-season time. And we assessed those athletes, and we gave a report saying, oh, this athlete should increase her muscle strength because it can be a higher likelihood to be injured if he gets like he or she is it now. So we work a lot with assessment. And based on this experience, we came with an idea to develop an application. So now we have an application that is a tool to help the physios to assess the athletes. So this is one example. I not gave up of my entire life to be in that company, but we have this idea and we developed it. So just one example, okay? And finally, promotion of fair play and anti-doping practice. Everybody that works in sports should be aware about this. So as we work, we also need to promote these two items. So, oh, my slide's not passing now. Yes. So I came with the graph again, but now organizing the 11 competencies in big items, okay? So this will help you, for example, if you want to develop the pathways to get the IFSPT approval for international registration that we talked a little bit about yesterday with the board. So if you look at the center, is the basic thing that's deal with managing your athlete, about injury prevention, acute intervention, rehabilitation, performance enhancement. But if you look further, we need also to promote a safe and active lifestyle. We need to be an advisor if you look at the bottom of the graph, the item 5. If you look at the left, item 6 and 7 will help you to be a leader. Lifelong learning, professionalism and management. Item 8, that's in the right, you need to be innovator. So we need to be involved in research to be aware of it, to help to reach this innovation part. Also, you need to disseminate the best practice. It's the item 9 that's in the top. So this will help you to be a leader. So this happens a lot to me. I didn't end my graduation and I said to myself, okay, I want to be a leader now. It's not happened like that. I see myself as a leader now because physios that are younger than me reach me with questions. Sort of like, oh, Luciana, what do you suggest for me to do now? I do a specialization or I do a master degree. What do you think is best for me? This is an interesting question. The person should know what is best for he or she, but they want my opinion because they see me as a reference, and this is really good. But this increases my responsibility also. So I need to be aware of these 11 competencies. So just to end this part, on the right, the item 10 will help you to be an innovator/advisor, standing practice through innovation. Item 11 on the left, promotion of fair play and anti-doping practice will help you to be a leader and advisor. So we close all the 11 competencies organized in this graph. This is the base of the pathways that you need to develop if you wish to. So I'm talking specifically about injury prevention now. This is a famous sentence that was said by Albert Einstein. So Albert Einstein said that intellectuals solve problems, genius prevents them. It's easier to not deal with any problem. Nobody wants problem in their lives. Our goal as sports physical therapists, it's not have athletes in our department treating injury. Get a lot of athletes injury, and we are working a lot. Do you think this is a good thing? It's it's the worst scenario. Shows that physio and strength conditioning coach and the coach, whatever, all professionals that are working with the athletes are not doing their best because the athletes are getting injured. The dream of all sports physical therapists should be no athletes on the department, on the clinic, all athletes on the field, playing, practicing. This is our dream. So this is a good start for us to discuss prevention. It's really important. For me, it's the most important thing that a sports physical therapist should do. It's just my personal opinion, okay? But I'm not saying that this is easy. And I will deepen in this prevention, sports injury prevention scenario. So probably you have heard about the Van Mechelen sequence of prevention that shows in this slide. We have basically 4 steps that we need to accomplish to prevent injury. So it's a really easy scheme, and I will explain to you, and I will discuss some issues related to each step, but I'm being here like, how can I say this in English? I will indicate some challenges that we have. So maybe I will not have all answers, but I will be like a kind of provocative. I don't know if you mean what I want to say here, but we can discuss this after the presentation. So the first step for me to prevent anything, if it's injury, is because I want to go to the market and don't get wet because of the rain. If I want to prevent any issue, I need to understand the issue. So the first step is to understand the problem that I want to prevent. The second step is to understand how this problem happen? So first step, I need to identify which problem, what it's the problem. Our problem is injury. Second step, I need to understand how injury happened. Because I need to understand how to do the third step, that is to prevent. I need to understand the how to eliminate factors that leads to an injury, because the consequence is prevent. And the fourth step, the last one, is to identify the effectiveness of the prevention program that I built for this group of athletes, for example. Because I need to be sure that this effectiveness is related to decreasing the problem or eliminating the problem. I just want to say one thing here. In sports scenario, we are never going to have 0% of injury. We are always going to have injury because it's a consequence of sport practice. But with prevention, we want to diminish the number of injury or even decrease the time loss that the athlete have. If an athlete have, for example, an ankle sprain, that's a really common injury in athletes. What is better? If my athlete have an ankle sprain and get 2 weeks without practice, or get an ankle sprain and have only 2 days off. If I can, with my prevention program, shift this athlete for being 2 weeks without practice or only 2 days, I'm preventing injury because I'm decreasing the severity of this ankle sprain. If I increase, for example, the stability of the ankle joint, the strength, and my core, probably this athlete will have an ankle sprain, but less severe. And this is good. So we need to be aware that not always dealing with injury, preventing injury is decreasing only the amount of injury. We need to be aware also about the severity, the time loss of athletes. So now I start to be a little bit provocative. Okay. So I will analyze each step. Okay, so the first one, the problem, injury. It's reasonable to understand here, to say here, that we need to have a proper injury registration in our sport team. The first thing that I need to understand in my athletes is which are the most common injuries that my athletes have. It's more ankle sprain, patellar tendinopathy, it's low back pain. What is happening with this group? Because I need to understand what is going on with them to understand my problem. So it's interesting to see this publication about Green that was published in 2014. The authors identified that soccer teams doesn't have a proper injury registration process. When I told you about the process, when I use this word process, I'm talking about not only register the injury when the athlete is new on your sport team. Okay, everybody, when you're receiving an athlete that is entering now in your club, of course, you will talk with this athlete and try to understand the previous injury that this athlete have, or if he or she now has any injury, you will assess this athlete. Okay, this is a basic sense. But most important, these soccer teams didn't follow up the injury, the athlete regarding injury. So for example, during the season, they didn't have a system to keep registering the injuries that their athletes are having during the season. So this is a really big issue. So it's important for the sports physician. I don't know who is the responsible for the injury registration in your sports team, but you need to have this person. We need to have one person to take this responsibility because we need to keep tracking our athletes about injuries. We are understanding, identifying the problem here. So we have some limitations about this step, and this could also contribute to our lack of evidence about injury prevention, especially in elite athletes. Second step, about understanding how the injury is happening, the etiology of the injury. So we know that the same injury could have different mechanisms. I give you here an example about Pcl rupture, the anterior cruciate ligament rupture. So we know that for athletes that have a high demand of jumping, for example, volleyball, basketball athletes, when they land from a jump, they usually can do excessive knee valgus. This knee valgus is the most common mechanism for these athletes to rupture the ACL. Okay, we know about that. We have a lot of information on the literature, but we can't assume that is the only mechanism for ACL injury. Because, for example, athletes that do skiing, they have the most common mechanism is knee hyperextension. So when they have this knee hyperextension, they get the ACL rupture. So different mechanisms, different movement patterns leading to the same injury. We need to understand, because if I'm assessing, for example, a group of volleyball athletes, I want to see how is the movement pattern during landing. Makes sense because they are jumping. And if I want to prevent knee injuries, I need to see the pattern, their landing pattern. But this is not the same reasoning, for example, if I'm going to assess skiing athletes. I'm not concerned about the landing patterns. Maybe I'm more concerned about the stability of the knee joint, for example. So this information will change the tests that I'm going to include in my, for example, pre-season assessment. That is the understanding of the problem. So, and we also need that same injury could have different interactions between factors. About this subject, we have some limitations in the literature, and I'm going forward to these slides to make my idea here clear to you all. So we published this paper in 2016. I don't know if you read it. It was published in the British Journal of Sports Medicine. It's a really important journal on sports medicine field. And we had discussion with a lot of researchers that we work together, because we are like feeling that we were not looking properly to the injury in the past. Because when we read papers related to identification of risk factors to any injury, we frequently saw that one factor isolated was related to injury, 1, 2, or 3. But when we apply this information of the literature in our clinical practice, this information was not helping us to prevent injury. So we are not understanding the injury phenomenon. So this paper brings another view, another possibility to see how injury happened. So the proposal here is to see the sport injury as a complex emergent phenomenon. So we think that we should look for the existing pattern of interaction among factors. We need to look for the relationship between factors instead of looking for each factor itself, isolated. I'm not going to deepen in this thing, but I suggest the reading of this paper. It's a really good one. Maybe we'll change some rationality that we already have about sport injury. So why I'm talking about this? Because you need to have a clear clinical reasoning to take your actions. And I'm not talking only about prevention, I'm talking about everything. So which reasoning do you use to guide your clinical decisions? Related to assessment, related to interventions, related to prevention, related to everything. So I'm going to show you just one example here. Just one example, because I need to be quick on this. And it's about this figure that is on the slide. This figure is from editorial that was put by Jill Cook and Sean Docking in 2015. It's not that that new. It's published 5 years ago, but it's a really interesting paper that shows us how we need to deal with tendon. So, for example, my clinical reasoning, one thing that I need to consider on it is which tissue that I'm dealing with. I need to consider tissue physiology and also individual characteristics to understand why that athlete had injury. So when I think about tendon rehabilitation, okay? So the first step, I need to get this, increase the strength of this tissue, of this tendon. I need to increase the capability of this tissue to deal with stress, deal with forces. Okay, that's basic. But when I deal with tendon, I need to do very small steps because the metabolism of the tendon is lower comparing to a muscle, for example. And tendon needs rest between intervention sessions, let's say like that. Specifically talking about the strengthening interventions, okay? So I need to do this really progressively, really small steps. Then I go to the second phase, that is increase energy storage. And the way that I can do this is only through eccentric training, of course, of the muscle that are related to the tendon. I need to increase the capability of this energy storage. So with a good tendon strength and with a good capability of storage, then I can go to the third phase, that's energy storage and release. Only in that phase I can include plyometrics, for example. Because when I include plyometrics, I need to be sure that the athlete's tendon can deal with this amount of stress of this exercise. So it doesn't make sense to do plyometrics, for example, in the first phase, when my tendon still doesn't have proper strength, when my tendon can't storage energy. So I need to think, to rationale about everything that I'm doing with my client, with my athlete. So it's just an example, just to make your minds running a little bit there. So getting back to our sequence of prevention, the third step, that's about prevention. So after understanding the problem, identifying the problem, understanding the problem, I will build my prevention program and implement in my athletes. So just a question. Do you think that the same prevention program could be implemented despite cultural, social, economic characteristics of the sport modality, of the athletes? Do you think that this is not going to impact in any way on my prevention effectiveness? That's the last step. Just to think about. It's different when I deal with youth athletes comparing elite athletes. It's different. My prevention strategies need to be different because the routine of these athletes are different, comparing youth and elite. The demand is different. Do you think that prevention should be different considering female and male athletes? Or do you think that female and male is the same? We know that women and men are not the same. So we need to deal with these athletes in different ways. And I'm just giving here two items to discuss. We have a lot of other things to consider that I'm putting on the bottom of the slide. Do you have enough space, proper space to deliver your prevention? Do you have materials? Do you have time? Do you have health professionals to help you on that? I'm always thinking about, this is really important. Do you think that only the sports physical therapist is responsible for prevention? Or do you think that strength conditioning coach is also important on that and should be engaged on that? Do you think that physicians have an important role and the coach? So I'm raising here more questions than answers. That was I was saying to you at the beginning of my presentation. So I looked for the most recent evidence about prevention, and I found this systematic review that was published in Journal of Science and Medicine in Sports. That's a good journal in our area, and the paper is about injury prevention strategies specific to pre-elite athletes competing in Olympic and professional sports. So what were the findings? I put the most important findings in this box at the screen. So we need to understand a lot of issues related to prevention, because when we look to a systematic review, we hope to get a good evidence based on a lot of articles. That's why it's a review. But we are not able to get strong conclusions because we have insufficient evidence. We have, when we have the evidence doesn't have a good methodological quality. We are not dealing with the specificities. So see, for example, the last item. More injury prevention intervention studies need to focus on female athletes. So we have a lot to explore when we deal with injury prevention. So this is not to get like, to make you all sad. Oh my God, we don't have good information, conclusions, or Luciana is showing us that we have a lot of questions. It's not for us to be like depressed. It's for us to be more aware of our needs. We need to advance. So, at least about the effectiveness will be the last step of the sequence of prevention. So based in all information that I talked to you about, we can understand that we have a lot of challenges. Because how we are going to identify the effectiveness if we are not having a proper injury registration? How to define effectiveness if we are not understanding properly injury etiology? How to identify effectiveness of prevention program if you are not consider different cultures, contexts, social, economic things, environments? So we need to understand this all, because only doing that we are going to be more fair with injury effect, with prevention effectiveness. That's my feeling. Okay, not only my feeling that I share with other people that work with this and research about this also. So some examples here, just to make the thing more applicable, let's say like that. So, for example, athletes' behavior matters in injury prevention process. This slide shows a study that was published in British Journal of Sports Medicine, good journal, on 2017. And it was like an overview of systematic reviews with meta-analysis that is our highest methodological quality evidence. And the authors want to look at the treatment and prevention of acute and recurrent ankle sprain. We know that orthosis is a preventive measure that works, especially those athletes that already have an ankle sprain. It's really an important preventive measure. So everybody knows about that. The literature, the evidence says that this is important. The clubs that deal with modalities that have a high incidence of ankle sprain knows about this, but we are not being able to prevent this injury. So looking deeply on that. Another paper published by Cusimano and colleagues in 2013 shows that even athletes that had ankle sprain history didn't wear orthosis. Why? Because of aesthetic appeal. The athletes think that it was ugly. They don't look good wearing the orthosis. What was the strategy used to increase the compliance related to orthosis? It was education, saying to this athlete, John, Mary, you had ankle sprain, so it's important for you to use the orthosis because this is going to prevent a second ankle sprain. This also including the coach reinforcement. So when the coach says, okay, John, Mary, you need to wear this, they listen to the coach. Coach have important lead role on every sports team. So we need to engage the coach on prevention process. This is really interesting information. Another challenges are related to implementation of injury programs. So planning and organization can impact positively in implementation. So one example, Luckin and colleagues identify reasons for athletes do not complete the strength training program without supervision. So they didn't have the strength conditioner coach or physio together with them during this program. So we might think in a home-based program, for example. So, but they saw that the compliance was low. The main reasons for this lack of compliance was almost half of the athletes said that they had lack of time or lack of knowledge on how to perform the exercise progression. So maybe this lead athletes to make like insecure and they prefer not to do the exercise. So we need to be aware that we have an important role of education. These athletes, all athletes, needs to be educated about the importance of prevention and also educated about how to perform the exercises. Another challenge related to compliance. So, of course, I will only see effectiveness in a prevention program if my athletes do the program, if they get a high compliance on it. So Tianis, Bone, and Brooks identified that female basketball athletes had low compliance on home-based prevention program. And the main reasons that the athletes said was, I did not have time to do the program, or I forgot to do the program. So this shows us that we need to incorporate prevention on athletes' routine. Athletes don't forget to brush their teeth. Athletes don't forget to eat their meal. Athletes don't forget to drink water. They know that this is important. So prevention, it's important to their sports practice. So we need to engage this issue in their routine. So I know that I raised more questions than answered questions here with this talk, but we need to keep going. being like Sherlock Holmes, you know, when we are dealing with injury prevention. We need to look deeper, understand, and came up with different strategies. And at the end, see if these strategies are getting better or increasing our prevention, our injury prevention. So just to finalize my talk here, what are the roles that the organizations have? So for example, I put here the Brazilian National Society logo and IFSPT logo. So Indonesia Sports Physical Therapists Association also, we all have on these organizations a source of information and guidance to physical therapy clinical practice. When a physio, a member or not a member have any doubt, he or she can reach these associations to have a pathway to go to search. So it's important to be aware of this. And maybe this is one of the reasons that I'm doing the postdoc here. And part of this postdoc are being supported by IFSPT. My postdoc is about sport injury prevention. So I'm doing 2 big studies here, and you from Indonesia are helping me on that. So the first one, and IFSPT is helping me on this, because through IFSPT, I'm reaching all 34 members that we have. And these members' organizations are reaching their physios to join and fill in online survey. So this first study is how prevention programs are being structured and implemented worldwide. We don't know about it. We don't have evidence that tells me, okay, countries that are in South America have some difficulties to do this, and this. Countries in Europe have more facility in doing this. We don't have this information in the literature. So the purpose of this study is to identify the state of the art of injury prevention, sport injury prevention specifically, and understand their role that physical therapists have in this process, and characterize how prevention is being done in countries around the world. So I'm really anxious to have this information, but we need to wait a little bit. And the second one, it's about to establish a consensus. So it's a Delphi study, and the process is different because it's an online survey also, but the aim here is to develop an evidence-based consensus. So only experts in sport injury prevention are participating in this second study. So I'm reaching experts all over the world to understand what they think that is important to consider in injury prevention strategies, implementation, structure, and this kind of things. So it's a really big challenge to deal with people around the world, but I guess I hope that we are going to get really interesting information from these 2 studies. So to finalize my talk, I have some take-home messages here. So we need to identify context-related issues about injury prevention, and that's what I am trying with my postdoc. We need to engage all health professionals, coaches, and athletes in injury prevention. We need to work as a team. We don't have a person that is more important in this process. For me, if I need to choose one person that is more important, it's the athlete. It's not the physio, it's not the physician, it's not the coach, it's the athlete. So all professionals need to be aware of this and help the athletes to accomplish prevention routine. We need to plan and organize our preventive actions. We need to register everything. We need to think before get into action. And we need to register all actions. We need to register compliance, injury occurrence, and re-injury, and everything that you think that's important to help you to understand injury prevention process in your sports team, in your context. So that's it. Thank you very much. And now we have a really good discussion. Chakra, if you could please end the sharing, because I can't do this here. Yes, thank you.
Oke, thank you, Miss Luciana. Jadi teman-teman, tadi sudah dipaparkan ya. Semoga tadi saya lihat ini chatnya ada yang bingung, ada yang mudeng, tapi it's okay lah ya. Okay, now we are come to the question and answer session, and Miss Luciana, I will share the screen. Wait. This is okay. Miss Luciana, this is the question.
Okay. So you want me to read and answer each one of that, or you want to?
Just answer with the name. Yeah, you can tell the name and your answer. Okay.
Okay. So from Jonathan, how do we address the blurred lines and roles between sports physical therapists and other Jonathan, this is one of the 1 million questions that we have in sports scenario. I know that it's common. We have some struggles to deal with the relationships among the professionals that work with athletes in a sports team, for example. But I need the most important word to help on this is communication. We need to communicate with our colleagues, and we need to understand that everybody is important in the process. So I only can tell about my experience here, and if anyone can share, want to share the experience, we can talk about. But for example, when I worked in the Brazilian National Society, Brazilian National Volleyball team, I had a difficulty to approach the strength training coach, because he was like sure that only he was important during the process of prepare the athletes to go to the training, to have a good strength. And in the beginning of the season, the coach and strength training coach were really heavy on the athletes. They had, for example, jumping session training in the morning on the beach in the sand, and in the afternoon another session of jumping in the court. So of course, less than a week, I had 50% of the athletes complain about patellar tendon pain, and of course the athletes came to me. So when I went to the strength training gym to saw that the work that the strength training coach were performing with the athletes, I saw that they were not strength training the gluteus maximus. So we know that the gluteus is important, have an important role, for example, in landing from a jump, to absorb energy and this kind of things. So I asked him, John, it's a fictitious name here. John, why the athletes doesn't strengthen in the gluteus maximus? I think it would be important because they are complaining a lot of knee pain. Maybe their hip are not strong enough. And he told me, oh my God, do you think that I'm going to perform with my athletes a female exercise? Because what he means with that, do in a form, oh my God, how can I say this? It's like a cat, it's a for dog position, cat position, and do the hip extension. I couldn't say anything. I shut off my mouth and I go to my room and I went to PubMed and I searched for papers with good evidence saying that it's important to have gluteus strength to decrease knee stress, knee joint stress. And I print and I gave to him and I said, John, I was reading these papers, these articles, and I think that they are really good. And I want give you this because your opinion is important to me. I want to know what you think about that. And can we talk a bit about that? Please, thank you. And I give him. I don't know if he read or not the papers, but next day I went to the gym, the strengthening gym, and the athletes were doing gluteus strengthening. So maybe you found a person that is not easy to deal with, but you need to come with some strategy. And most important, this person needs to be engaged in the process. Would be like a really mess if I said, oh, I think you need to do gluteus strengthening and keep fighting on this. So I just educated him, you know, I give the information and he came up with a good solution that it was follow the evidence. So we have some struggle sometimes to deal with other professionals, but I think everybody, it's important. I would love to work with a biomechanist in my sport team, with a physician, with a psychologist, but making sure that each one is doing their role, not interfering in an area that is not uh, allowed to them. I don't know if I answer you, Jonathan, but I always came with this example when we talk about relationships inside sports team professionals. From Ferdian, I don't know if I'm saying the names properly, but are there any tips on how to make a PT create a preventive program for a club? How to make a good program if the training schedule and competition schedule are tight? Okay. Ferdian, I can say about my experience again. We need to assess our athletes. As physical therapists, we need to assess. We need to understand how which dysfunctions each athlete have. So the way that I usually do is to identify the problem. So which are the injuries that happen most with my athletes? And then I build the assessment based on this information. So, and of course, sports modality is important. So for example, if I am with a volleyball team, I'm going to look landing pattern. For a good, proper landing pattern, the athlete needs to have good gluteus strength, good ankle dorsiflexion mobility, good foot alignment, good core. So I will include tests that gives me information about these things that I said, strength, alignment, mobility, or range of motion. And based on the information of my assessment, I will come with the exercise, the preventive exercise. So, for example, if I identify that the majority of my volleyball athletes have restriction of ankle dorsiflexion, one exercise or two that will be included in my preventive routine will be related to increase ankle mobility. How can we do that? Because of the time consuming thing and routine. We can, for example, include something in the warm-up session, so we can talk with the strength and conditioning coach and say, John, whatever name you want, John, we have 80% of our athletes with restricted ankle mobility. So it would be really important to add this during warm-up sessions. Do you think this is possible? And we work on this together. Could be during the warm-up session, or even on the relaxation time after the practice. But we need to include this. Even we can include this as a home-based training for athletes. But in my experience and opinion, if the intervention is important for athletes, so for example, we have really good evidence saying that if an athlete, a jumping athlete, basketball, volleyball, had ankle dorsiflexion less than 36 degrees, he or she, it's increased likelihood to have patellar tendinopathy. So if an athlete have less than 36 degrees, I want to do the intervention with this athlete, because not always will be possible to increase a higher amount of mobility only with the athletes doing like stretching or mulligan. Maybe the physio needs to get the hand in the athlete and perform the exercise. So if this is the case, I will do this with the athlete, and I will add exercise for he or she do at home to increase my effect. I don't know if you understand me. But I know the schedule is very tight, but we need to work on this. We don't have options. Your schedule will be tighter if athletes get injured, because you need to be treating this athlete and maybe doesn't have proper time to go in trainings, go in competitions. So at the end, I think if you look further, we will decrease this tightness of our schedule if we do a good prevention program. It's okay, Shaka? I'm understanding the questions and answering properly.
Okay, Ms. Luciana, you can answer question related to the presentation. Skip questions that are not included in the presentation.
Okay.
Yeah.
From Octo.
Next slide, Chakra. Next slide. Next slide.
Okay.
Yeah.
Okay. Are there any tips for taking precautionary steps for athletes to avoid the injury?
From Fridos, maybe.
You need to do prevention. We need to understand the sports gesture of the modality. We need to understand the characteristics of the athletes to try to prevent. I always think that athletes, we should increase the capability of the athletes, because with a higher capability on tendons, muscles, whatever, we can increase demand without likelihood to increase injury. You know, that's my reasoning. What's the strategy for injury prevention during COVID? That's a good question. I don't know how is in Indonesia this thing about Corona, about COVID, but in Brazil, our Olympic Committee released a good material. Of course, it's in Portuguese. If it was in English, I could share with you, but indicated some guidelines about how to deal with athletes with the social distancing, and also how to deal with athletes when the trainings started. So in Brazil, some teams already started their routine. Soccer teams, for example, they started their routine kind of 2 weeks ago. So we are learning from the process also. We need to see what our health ministry is guiding about this, and also the organizations that are related to sports. But the physios are using masks, and they are working with minor groups of athletes. They are not getting all athletes together, so they are doing like a schedule with smaller groups to train and also to prevent and to do all actions that are needed too. Do we have, I can see the, because there's a mess, yes. Do we have to do endurance and strength training program work together in prevention? No, we need to do everything that is in our power to increase the athlete's capability. So I'm talking about strength training, endurance, power, mobility, flexibility, stability. It's a really important thing, especially functional stability. We need to do it all, not alone. We need to work together with the strength training condition coach.
Next, Chakra, next.
Okay, Pak.
Each exercise will cause new injury in the soft tissue. How to prevent injury so that it does not interfere in the healing process? I don't know which, what specifically are you thinking, Alfian? But for example, if an athlete have a hamstring strain, okay? Let's say that it's a moderate one and he have like swelling and pain. So, okay, he will not be training. He will be off training on the field. But he can do training in a gym, for example. He is able to perform some exercises on upper limbs, trunk, even the leg that was not hurt, injured. So we can do a lot of things, even with the athlete that get injured. Of course, we are going to treat the injury also, but if we have a good knowledge about which kind of tissue was injury and the location of this injury, we can do things that will not interfere on the healing process. And we always need to be aware that it's also bad for the athlete when he doesn't do anything, like immobility. Oh, I'm injured, so I'm not doing training sessions, gym. I'm not going to the physio, or only do interventions to locally help the injury to get better, to heal. It's bad because biologic tissue needs load, needs stress, needs mechanical energy to adapt and be better. So the best example is if I get an athlete and lay down him or she in a bed and say, don't do anything. Of course, this is like, it's not real life. But if we do that, the athlete will lose capability, not only about the heart condition thing, but tissue. He will lose tissue. Tissue will start to degenerate, and he will decrease the capability. So we can do a lot and not interfere in the healing process. The best way for you to identify if you are doing this or not is to observe the reaction of the athlete in 24 hours after you implement some intervention. If the athlete doesn't worsen the pain and the function, you did a good job. Keep doing it. If the athlete had increased the pain, so maybe you get too strong. So one step back. So that's my opinion. From how differentiate treatment about female and feminine abuse? Okay, we have a lot to learn about male and female differences because we don't have so many evidence on this for now. One thing that we need to be aware is about hormonal issue, because hormonal, of course, between male and female are different, but especially the estrogen plays an important role that's different compared to testosterone. So we need to understand that. I think that IOC have a statement on that. Maybe go to the IOC website and try to search for these consensus statements that they include there. I think we have the IOC have one on this subject, but we need to understand more this difference between male and female. How to preventive for children who want to be athletes, but he has anatomical structures such as flat feet. Okay, children, it's another area also. We don't have so many evidence about injury prevention in children and how to deal with this, but we need to understand about physiology, to understand what is happening with the children related to the age and about the hormonal changes that he or she are going to face. So, but for example, there is not, we don't have a consensus in the literature saying that anatomical structure for itself increases injury risk. So the example that you gave here, Prospida, about flat feet, I know what you mean about flat feet or excessive foot pronation. We have some papers that shows that there's some relationship with this and injury, but as I said in that slide about complex system approach, one factor will not cause an injury by itself. In the real world, we deal with a lot of factors interacting, and this interaction gives a higher probability, for example, to get injury. If it was simple like that, just one factor related to injury, our life would be easier to prevent. Because imagine it, okay, so I just will, for example, assess the foot alignment of this child, and then I will do like a foot orthosis to decrease the biomechanical consequences of a foot pronation or excessive foot pronation. And that's it. This doesn't mean that this child will never get injured, because I'm dealing just with one factor here. So it's not an answer, but just made us think a little bit about that.
Okay. Okay, Ms. Luciana, this is the last slide.
Okay.
Okay.
Janiko, what is the most important to prevent re-injury in ankle? Also do strapping. Strapping, we have some. I know that athletes like strapping. I know that she feel confident about strapping, and we should keep doing it because make the athlete happy. But we need to be aware that the tension of the strapping lasts only 10 minutes. Depending on the strap, could be 20 minutes. But if I'm considering here a session training or a match, we know that this strap will have no effect during the majority of the session or this match. So that's why orthosis is important, because this orthosis will help on joint stability. But it's also important, and it's related to this preventive measure linked to the use of orthosis, that this orthosis goes only during match and some parts of training. The athlete can't use the orthosis all the time, because with the consequence, if he or she uses the orthosis all the time, is the ankle will lose strength and stability. So we need to keep training this athlete on these two things, strength and stability. to accomplish this, he needs to train also without the orthosis, some part of the training. From Lucky, it's now very common about the prehab program to athletes. Then they said it's also prevention program. I don't know what is a prehab program. Could you please tell me? I don't know.
Rehab is like before rehab. So it's like it's commonly in Indonesian commonly it's prehab is the like prevention program before rehab. Pre-rehab is before rehab.
Okay.
Is there also the prevention program or not? Because in Indonesia we use pre-rehab program for the words, for terminology. Use terminology pre-rehab program. Pre-rehab is the before rehab. Is common or not?
I will give you my opinion on that. I never heard about this term, pre-rehab. But for me, it's simple. Rehab is different from prevention. It's two different things. Prevention is about prevent a problem, prevent an injury. So the athlete at this time doesn't have an injury. I'm preventing. Rehabilitation, it's about prevention. It's about injury. I'm sorry. I will only have an athlete doing rehabilitation if this athlete gets injured.
Yes.
So for me, it's two different things. Even our assessments related to prevention and rehabilitation are different. So we just need to be aware which is your objective with the athlete at that time. If you are not concerned about an injury that is already there, you are preventing.
Okay.
Udah Pak ya?
Udah ya.
Oke, baik, Miss Luciana. That is the last question. Buat teman-teman yang pertanyaannya belum sempat dibacakan, mohon maaf ya karena waktunya memang sudah sampai pertanyaan yang tadi. Miss Luciana.
Yes.
For closing, could you give us a closing statement about about your presentation today?
I just want to thank you all for joining us here in this conversation, this discussion. It was really a pleasure for me to talk to you about injury prevention. It's a topic that I really like to talk about, and I'm sure that we need to go further on this. And I hope to get all IFSPT members, and especially Indonesia, some data about my research that you are helping me to build that. So thank you very much for your help, and thank you very much for this opportunity to know you. And I hope to see you next year in our World Sports Physical Therapy Conference.
Okay, Ms. Luciana, thank you. We would like to say thanks again for presenters and all of the audience for active participation. And hopefully the presentation will give benefit for us. Thank you for your attention. Thank you for all presenters. Thank you for sharing your knowledge, sharing your experience, your insights. God bless you and your family, and see you later. Bye-bye.
Thank you. Stay safe. Bye-bye.
And then you can finish your research successfully.
Oh yeah.
Yes.
And then
Thank you. I hope so.
And then you can share the result for us. Yeah, we develop the injury prevention in Indonesia.
I'm anxious to have this data and share with you all. Thank you very much again.
Thank you very much once more. Thank you very much.
Stay safe, everybody. Bye-bye.
Bye-bye. Baik teman-teman, itu tadi presentasi dari Miss Luciana. Mudah-mudahan apa yang dipresentasikan tadi banyak yang nyangkut di kepala ya dibandingkan nggak mudengnya. Mohon maaf jikalau tidak semua pertanyaan saya berikan dikarenakan waktu yang cukup terbatas, dan mudah-mudahan untuk next time-nya kita bisa bertemu lagi, kita bisa gabung lagi dengan pemateri-pemateri tentunya yang tidak kalah menarik dari pemateri-pemateri sebelumnya. Dan saya harapkan teman-teman di sini semua, audiens di sini semua bisa memahami apa yang disampaikan Luciana tadi, bisa memahami apa yang sudah ditampilkan oleh Luciana tadi. Jikalau memang teman-teman ada yang ingin bertanya lebih lanjut, bisa ditanyakan kepada senior-senior yang ada di PFOI tentunya. Dan buat teman-teman yang belum sempat bergabung atau sinyalnya kurang bagus, kami mohon maaf. Dan mungkin Pak Indra, jikalau apakah materinya tadi bisa dimintakan oleh Luciana atau gimana, Pak?
Bisa dilihat di YouTube ya untuk materinya.
Oh
Jadi kalau
iya,
yang butuh
oke.
materinya bisa lihat di YouTube.
Oke, baik teman-teman, itu informasi dari Pak Indra. Jikalau ada yang ingin melihat kembali atau ingin mereview kembali materi-materi yang sudah ditampilkan tadi, teman-teman bisa masuk langsung ke YouTube-nya PFOI dan bisa dilihat dan bisa di-pause tentunya ya. Jikalau ada pertanyaan bisa dihubungi pada teman-teman di PFOI. Baiklah teman-teman, itu agenda kami dari
Mohon maaf,
tim
Cakra,
PFOI.
penutupan
Ya.
dulu Pak Rashid.
Oh ya, baik. Penutupan dari Pak Rashid bisa disampaikan, Pak. Baik, terima kasih Pak Rashid. Mungkin Pak Indra ada yang mau disampaikan, Pak?